Hi everybody. I just wanted to take a few minutes tonight to talk to you about therapies. So at any point during this video, I do have right up here kind of the web address for all of the slides that I'm going to show you tonight. So as you've read through the chapter, there are many different kinds of therapies, and even compared to what you read about in the text, there's even more therapies being developed all the time. So, you don't really want a therapist with an eclectic approach. You really want therapists now utilize an integrative approach. So, at one point, many therapists would, when we think about the modern psychotherapies, a lot of therapists would, have kind of a home in one of these areas, one of the therapies that they felt most comfortable with. So when you think about psychotherapy, that's talking about all the therapies together. So for this assignment, you want to pick one therapy to research fully. So to look at the differences, the ones explained in the text, we have the psychoanalysis, psychodynamic. Really, the therapist interprets the patient's memories and feelings. This is a really long type of process. It's not a quick therapy. Client-centered is more of our humanistic therapies. There was a video that I showed you guys with Gloria. I know it's an older video and some of it's quite amusing to listen to and watch, but really these are kind of the gold standard that we use in therapy. These are true therapies being used. So therapist really doesn't give a whole lot of feedback. If anybody watched with Gloria, the therapist just really actively listens. We have our behavior therapy, which is really changing behaviors using some specific types of therapy. We also have cognitive therapy, where we're really kind of training people how to dispute irrational and negative thoughts. Cognitive behavior is how do we counteract those thoughts, new ways of thinking. There's also the group and family therapy as well. I really liked this chart from James. It's from a different text, but I really like this slide because, let me give you the full one up here. I really like this slide because not only does it talk about the therapies that we're covering in the class, but the psychological disorders, the goals of treatment, what are some of the therapeutic methods, and the role of the therapist. So as you can see, psychoanalysis, interpret associations, re-examine assumptions in those cognitive therapies, focus the client's attention, unconditional positive regard. That's something that we talk a lot about in therapy. So I really like this chart just because it gives that information if anybody's interested in getting into that. When we think about types of psychotherapy, as I was saying, there's different ones. We have individual therapy, where we use reality therapy, rational emotive therapy, behavior therapy. You can see there's many different types of behavioral therapy. Interpersonal therapy, that usually involves more than one person. So we have that marital, couples, family, child family, group therapy is also another area. These are more people that you're close to. Immediate people. Group therapy are people coming together who have a similar issue, concern, problem. Other psychosocial therapy, milieu, occupational therapy, play therapy, recreational, and a lot of these are really coming to light now as of important. They've always been around for many years. Many people didn't use them, utilize them, understand them, but given the change in understanding and people want more, some people want kind of more organic types of therapies, these are really being used. So even within the psychotherapy, we have three different kinds: supportive, rational, directive. So you may find that you have a, let's see if I can enlarge this. You may find that you have a therapist who's directive, and you may need a directive therapist, and they're going to be focused and technique oriented, and these are the types of therapies that they may use. You may need a therapist who's more supportive. They're going to be person-centered. They're going to be more nurturing towards you. So these are supportive types of things. And then you may need somebody who's going to be uh, a relationship with you. And, we're going to talk about those boundaries a little bit. So you want to think about, when we're talking of psychotherapy, the type of therapist as well. Some of our cognitive therapy techniques, and a lot of times people think cognitive therapy, cognitive behavioral therapy are one and the same, and they are indeed not. Behavioral therapy is actually changing behaviors, and that is used quite often with parents who have young children with behavior issues. Cognitive therapy is changing beliefs. Usually, those are irrational beliefs. So, we can see that we're revealing, testing beliefs, and changing beliefs in order to take responsibility uh, for our issues and for the thoughts and for the behaviors that we decide to engage in. So, cognitive therapy, is truly looking at just those beliefs that we have and how do we change those irrational thoughts. Uh, I like this fun little image here from the CDC. What can parents expect in behavioral therapy? Because a lot of times parents think, oh, I sent my kid to therapy, and yet I'm doing all the work. Yes, indeed. In order for your child to make changes over time, it needs to be done 24/7. Changes cannot be made in a 1 hour appointment once a week or even every other week. Changes have to be made 24/7. So the therapist is going to meet with a family. They're going to provide support. They're going to give parents some teaching techniques, and they're going to work with the child too of how to act, how to change behaviors, how to change the thoughts. And then between the sessions, the parents really do practice using the skills that they've used that they've learned and used with the therapist. They can check in. This is working. This is not working. Another part of this cycle that I like to include especially is schools, because the kids go to school and then they're away from parents for 8 hours, or maybe those kids even go to daycare. So when your child is in any type of therapy, it is a good idea to have an open line of communication with the school, the therapist, and yourself as a parent. Because those open lines of communication can really make sure that the child is receiving the same information using the same strategies throughout their day. So this is from Dr. Axe and talks about cognitive behavioral therapy. So this is a third piece. So this really looks at changing thoughts and behaviors. So originally CBT was used for depression. However, CBT is now used for many issues such as anxiety. Addiction is a huge one, all sorts of addiction, eating disorders. So it's actually able to change the brain, believe it or not. There's research that shows people who engage in CBT types of therapy can positively change their brain. These can be just about for everybody. There's lots and lots of studies around CBT. CBT they find is more effective than medication. Many people rely heavily on medication. We'll talk about that in just a moment for that quick fix. But cognitive behavioral therapy usually takes about 16 visits. So usually this types of therapy, if you're being seen every other week, it could take, 6 to 8 months. If you're seen weekly, it could take about 4 months. Usually I recommend people start being seen weekly, and then you fade off to every other week and so on. So there are, when we talk about cognitive behavioral therapies, there are, as again, different kinds. We have rational behavior, rational emotive behavior, dialectic or DBT. The DBT works a lot for people with access to and personality disorders. So this also works. I've seen people who are schizophrenic who have been able to use a type of CBT therapy effectively and not have to take medications, which is pretty cool when they're able to do that. This is just to show you how cognitive behavioral therapy works, say with anxiety, a little more specific. So we have a triggering situation, whatever that may be. So it's outside of us. But then it comes into our head, and what are our thoughts and beliefs about this? If it's a social event, I'm going to a wedding this weekend. A wedding is usually fun. So, but what are your thoughts and beliefs, and how are we interpreting it? And then this impacts how we think, feel, and what we do. So DBT really kind of focuses on here. We start to feel those triggers with anxiety. What is it that's going on? Who cares why it's going on, but what's going on inside of our head that's causing us to have anxiety, and what are we going to do in order to change that, to put in some coping strategies right away so we can break that cycle. Now we have biomedical therapies, and biomedical therapies is physically changing the brain's functioning by altering its chemistry with medications, using ECT type of treatment, using surgery. A lot of times today, people rely very heavily on medications alone. Hopefully, through your research, you will find that medications alone does not work. Medications alone were never meant to be used long term. These medications, and I know this is a very controversial subject for a lot of people, a lot of these medications are tested on adult males. So, they do become addictive because people rely heavily on them to take care of the stressors and to take away the symptoms that they're feeling. However, medication alone is never going to teach you coping strategies in order to deal with those feelings. Uh, your best bet in order to be able to live a fulfilling life is to utilize therapy along with medication, but to rely more heavily on the therapy. All studies show that medications alone is not effective. There are studies that shows that even those who need medications, having just therapy alone is more effective than just medications alone. So you want to really think about this. Our psychopharma is a genius. Because yes, it is changing the brain, and it's not always for a positive. For a lot of people, it is positive. On the other hand, too, some people do need those medications in order to be able to function within society. So when we have those therapies, sorry, I meant for this one to go earlier. We have psychodynamic therapy. When we think about some of these newer therapies that are coming out, psychoanalysis was, over many sessions per week, over years and years and years. We think about Freud of the id and ego and superego. Psychodynamic therapy is focused on self-awareness and into our own unconscious thoughts that we're having. So we're really developing a lot of insight. Interpersonal therapy is also another newer therapy. It's not as focused on inside, but the behavior change and symptom relief. So it doesn't look at a lot of past that, say, psychodynamic does. It really looks on current and what's going on in the present. So, who cares at 6 years old that this happened? We're going to focus on the here and now, what's going on today. With all therapies, it's really important that you have a good relationship with your therapist. If your child is in therapy, it's important that, yes, you do want to have a relationship, but it's more important that your child has a good relationship with that therapist. If you don't have a good relationship based on trust with your therapist, you will not be able to make change. You're not going to be able to make progress. So clients, they are entering therapy feeling vulnerable. They're feeling anxious, worried. What is this person going to think about me? How are they going to act? What are they going to tell me? So the therapist, some of the therapists, as we talked about, may be directive, and that's what you need to know. So when you're looking for a therapist for yourself, I always work with parents who have said, oh my goodness, who are you going to recommend? Who's best for you? Who's best for me may not be best for somebody else. Because, I want somebody who's going to give it to me straight, give it to me direct. I don't have 6 months to do this, but give me my homework and I'm going to go ahead and do my homework. Really challenge me. That's somebody that I need. Some people need more nurturing. Some people really need their hand held through every moment. I see that working with students as well. You begin to know your client and what they are and who they are and what it is that they need. But the therapist should have some clear boundaries. Boundaries and being consistent is really, really important. So when you're thinking about a therapist, I always recommend doing an interview. Go talk to the therapist, see what they have to say, see what they're like, even see what their office is, because a therapist is not a one size fits all type of deal. When we talk about our mental health, as you can see, everything that we've talked about so far comes into play with our mental health. So we talked about, family relationships. We talked about development. We talked about the Vygotsky's hierarchy of needs and whatnot, coping skills, self-esteem, our genetic vulnerabilities, our temperament, our IQ. All of this has a role within our mental health and who we are. And these are all things that therapists will take into consideration when working with you and providing a treatment plan. First visit, sometimes people are very frustrated because those visits are long and they said, well, nothing got done. Because the therapist very often will do, first of all, the paperwork piece and talk about insurance and confidentiality, but the therapist usually does an interview as well, where they're gathering all of this information and learning about you in order to develop that treatment plan and what the end goal is going to be. When we have, so this is to look at how all of those areas take into consideration. So we have something like bipolar disorder. It's not something that we're going to go alone. So when we think about psychotherapy, these are some psychotherapies that are very good for bipolar disorder. These are some of the medications that you may or may not be prescribed. We have to think about lifestyle changes individually, about exercise, unhealthy relationships, a healthy diet, making sure that we're taking care of ourselves. Those social pieces, family and friends who can support us. There's going to be other pieces as well that possibly we need hospitalization. We may need some intensive supports. Something else that's starting to come up is mobile apps. Some people will use mobile apps to collect data or to go through the different pieces that they're learning about their disorder, but also what is kind of the process that they go through when they're having a trigger and understanding that. And there's also now huge emphasis on alternative medications that people are going into, that art therapy. Some people use acupuncture. I love going to the chiropractor. The use of vitamins. When I go in and I say I've got, I'm feeling really anxious lately. She's not one to just prescribe medications, but she'll talk to me about vitamins and what we're doing to take care of our body and that mind-body relationship. Mindfulness is a big one right down there. So, those are all pieces that if we think about whether we have, if you think of this for any disorder, these are different things that are going to come into play as part of the whole treatment process. And the last thing I want to say is, a lot of people think that therapists are therapists, and indeed they're not. People think psychiatrists. In New Hampshire, most psychiatrists prescribe just medications. They're not doing a whole lot of therapy. This is the only therapist who can prescribe drugs or other biomedical treatment. If you have, I have no problems with people speaking to their PCPs and getting medications prescribed. However, one rule of thumb I always share with my parents is, sometimes they're struggling with whether this is the right medication, not the right medication. They're trying different medications, which can have an impact on a child's body overall. So I always say, if your kid were to break their leg, you'd go to an orthopedic. If they fell down and hit their head, you would see a neurologist. When it comes to mental health, be willing to go and see a counselor, be willing to go and see a psychiatrist, because just like an orthopedic, just like a neurologist, they are, PCPs are great, but they have a lot of information and they have a lot of general information. Sometimes it is necessary to go and see somebody who specializes that. Social worker does not mean that they're any less qualified than a psychiatrist. But social workers can have master's or doctoral degrees in social work. Social workers, they do have counseling, but they help a lot with those social types of problems. A psychoanalyst does that psychoanalytic therapy. I don't know a whole lot of psychoanalysts, to be honest with you, because the therapy um, is one, not covered by insurance, but two, is just very intensive and is a very long process. A counseling psychologist, doctoral degree in psychological or educational counseling. So counseling psychologists will work with people with milder problems. And then a clinical psychologist has a doctoral degree. I happen to be a school psychologist, so I can only practice within the school setting. So then you may have mental health counselors. That's not listed here. People who have master's degrees in the mental health field. A lot of times mental health counselors will be overseen by a psychiatrist or a clinical psychologist. So as I was talking about, there's different types of mental health therapists. There's not a one size fits all when it comes to therapy. So it's really important, hopefully through this assignment, that you're becoming informed about therapy, different types of therapies, what works for different mental health diagnoses and different people. So I hope you guys are having a great week, and I will email me if you have any questions. Bye.